Hi, it's Laura from Train to Respond. Thanks for stopping by. Today we're going to tackle some trauma issues and we're going to talk about frostbite. Frostbite is caused by exposure to cold. Signs and symptoms that you're suffering from frostbite: skin can look waxy. It looks kind of really waxy. It's weird looking. It's white, could be gray, yellow, or blue. Exposed area feels very painful. It can be numb, tingling area. And severe frostbite area, because it's actually frozen solid, it feels hard and there is no pain because it's frozen solid, right, with that one. I actually had this today. You know, we had a big ice storm yesterday in New Jersey, and I went out to clean off my car, and it was like frozen solid. And literally, I could just feel my hands were painful, my fingers, you know, I didn't have really good gloves on, shame on me. So I'd actually get into the car and just sit there for a while, warm up my hands. And I did it in stages because I could feel this coming on. You have to protect yourself if you feel that happening. Treatment for cold exposure like this: if you have frost nip, they call that superficial kind of frost issues, you do rapid rewarming, and they say skin to skin contact, right? Get into a warm area with that. So just start warming it up. It's just superficial. That's what I was suffering from today. But I could have progressed on a frostbite if I hadn't taken time out and gone into my car and sat there and warmed myself up there a little bit. You can lose fingers, toes, you know, noses. You can lose areas that are severely frostbitten and not treated. What you want to do is move the victim to a warm place, remove any wet clothing, remove anything constricting, get off any type of jewelry, right? You want to get the jewelry, the rings off the fingers especially, right? And you got nose rings or whatever, get them out of there with that. You want to seek medical attention. You want to have 911, call 911, have EMS coming, or get to the hospital. You want to absolutely seek medical attention for frostbite. You can rewarm if there is no danger of it refreezing. So say you get someplace into a remote cabin, right? And you know you're going to have to hike out and there's no help coming. You do not rewarm that area, because if you rewarm and then it refreezes, that causes deadly damage. So if you get someplace and there's no danger of it rewarming, you can start rewarming. Rewarm the frostbitten area in a lukewarm water, or whatever it may be. Something lukewarm, not hot, it's just lukewarm. You warm it for 20 to 30 minutes, right, with that one. If you're going to use a chemical hot pack, make sure you put some type of barrier device between the skin and the hot pack. We never put hot packs or cold packs directly on the skin. It can cause some harm with that. So put some type of barrier like a cloth or something and protect the area. A lot of times they'll put things in between the digits, right, like gauze or something, just to separate them. You could elevate it. Just make sure you protect the area. So again, that's 5 minutes of frostbite. I hope that helped you out a little bit. And be safe out there and take care of yourself. You feel these symptoms coming on, make sure you get someplace warm and nip it in the bud, as we say, right, so you don't progress on a frostbite. Thanks for stopping by. Remember, we have some free training at www.trainedtorespond.com. Active shooter survival training. You can go in there. It's just a quick course that you can do just to learn what to do to protect yourself. Have a great day. Thanks again for stopping by.